Hello, my name is Mphatso Phiri. I'm excited to share highlights from the research that I led as part of the LIGHT program, which was funded by UK Aid. My research aimed to generate evidence that will help increase the engagement of youth and men with TB testing and treatment services in Malawi to reduce the unfair burden of TB among men. My work focused on two key areas. First, we carried out a cross-sectional study to investigate whether men are more exposed to TB than women. We already know that TB disproportionately affects men globally and in Malawi. But we wanted to know whether that higher burden starts with a higher TB exposure. So what did we find? We found that from late adolescence onwards, TB exposure begins to diverge with a higher burden among men, which means that they have a higher risk compared to women. We also found something worrying. Boys and men reported much higher levels of tobacco smoking and alcohol drinking, sometimes up to 8 times higher than girls and women. These behaviors were also strongly linked to TB exposure. Together, these findings indicate that men find themselves more often in high-risk environments where the risk of TB transmission is more likely. This includes work and leisure places. Secondly, we analyzed data from a community outreach program for TB testing using mobile diagnostic units. These are large trucks mounted with X-ray and TB testing machines that drive across the country to bring TB testing services closer to people. This is an initiative which Malawi's National TB and Leprosy Elimination Program has been implementing over the past 7 years. These data show that when TB services are brought closer to communities, more men come forward for TB testing compared to testing in hospitals alone. More importantly, even when similar numbers of men and women attend community outreach TB testing services, 2 out of every 3 people diagnosed with TB were men. This means that community outreach testing is not only convenient, but also helps find those most affected and link them to care. This approach ensures early testing and treatment, particularly among men, which in turn reduces TB transmission in the community and therefore protects other men, women, and children. It's been a privilege to work closely with the Malawi National TB and Leprosy Elimination Program, who used our findings to inform Malawi's TB care and prevention services. I contributed to the review of the 9th edition of Malawi's TB treatment guidelines, which were launched in June 2024. In 2025, we supported the program in implementing a 2-week national TB screening campaign as part of World TB Day activities. I would also like to thank the Ministry of Gender, Community Development and Social Welfare for the opportunity to contribute to Malawi's first male engagement strategy, which aims to improve men's engagement in gender equity, gender-based violence, HIV and AIDS, and sexual and reproductive health issues. The LIGHT Consortium proved that reducing TB among men benefits everyone, including women and children. Let's end TB among men so that we also protect women and children. Thank you very much.